hookworms kill tens of thousands of people around the globe every year. Why are some Kiwis knowingly infecting their bodies with them?
Autoimmune disease has kind of been on the increase in the past few, I guess, decades, and they're just now trying to figure out what the cause for that is. But there has been some breakthroughs in regards to treating autoimmune diseases and putting them into remission. A lot of them are gene or genetically related. I've seen there's two videos I want to look at too that are going to look at alternatives. They're not genetically, they don't use any kind of gene treatment. But the first one, this is a research that was discovered recently where scientists take genetically altered cells to drive illness into remission. They basically took 4 women and 1 man, ages 18 to 24. They received transfusions of modified immune cells to treat severe lupus and I forgot the other one. But lupus, basically, it causes damage to heart, kidneys, brain, lungs. It also causes like this weird rash on people's face. I don't know. But basically, the treatment drove the disease into remission in all the patients, and they've all been off lupus medication for about 17 months. Doctors say that this raises hopes for tackling other autoimmune conditions like rheumatoid arthritis and multiple sclerosis. I hope so, because those things can affect us, especially in older age, right? That would be nice to get rid of arthritis. Actually had a manager a long time ago. He had arthritis, and he was a fairly young guy. At the time, he was in his 30s, but he was suffering from arthritis. But different from arthritis, the way lupus works is it develops when the immune system attacks healthy tissues and organs. And this is where they don't understand why. They think it might be triggered by viral infection. It could be. Maybe viruses are hiding in those tissues or cloning themselves and kind of contaminating the tissues. I don't know. And they say medicines, or it could be caused by medicines, or maybe changes in the body. They're not sure. But I know they say it affects about 1,000 people, 1 in 1,000 people. And yeah, I noticed it does seem to affect more women than men, just from what I noticed. Anybody I've seen have lupus is always usually female. I don't know if I've met a male lupus. Somebody, I think I might have heard one guy, but I'm not sure. But usually I've noticed that it does affect females a lot more for some reason. I don't know if they don't explain why. In a lot of cases it's mild, but it can, it makes people tired. That's one thing. I noticed there's a lot of fatigue when they talk about lupus. They get tired, organ damage, pain in the cells and muscles. Hitting the joints, sorry, in their joints. And again, that's that rash they get. But this therapy or this treatment was basically discovered, or basically based as a research group based in Germany. There were doctors. They treated severely ill patients with what they call a CAR T cell therapy. And this treatment is what they use for also battling certain type of cancers. They first used it in a leukemia patient back in 2015. So how the therapy works is they collect the patient's T cells and then they modify them so they attack new targets such as the cancer cells. And then this occurs after they infuse the cells back into the body. So basically they took this basic treatment that they used for leukemia and they used it to see if it worked with attacking lupus. So what happened is they took these T cells from the lupus patients and they modified them. They put them back in, and the modified cells attacked the patient's B cells. The B cells, basically in lupus, they're the ones that attack the body, and instead of defending the body, so they use these modified cells to attack the B cells. So basically, this treatment put their illness back into remission, and it also returned their B cells back to normal after a couple of months. They use blood tests to tell this. I think this is a great breakthrough. This is one treatment that I think it looks promising, and I think that they should probably see if they can implement this This seems like a more generic implementation. There's another treatment that actually uses gene therapy, and that looks at your gene makeup. With this gene therapy, well, it looks like gene therapy. What they do is they use people's individual immune cell fingerprints, and that pinpoints the exact treatment for their autoimmune afflictions. So this looks like a custom treatment. This other treatment where they basically modify the genes, it seems more custom than the one where they modify the cells, because it seems like the treatment where they modify the cells, they can use that for anyone else, but this custom treatment is basically that person's gene or that person's cell fingerprints. So basically this one gives people specific treatments for their needs, and it also helps scientists to develop new medications for the disease. But again, these medications will probably be more custom, so I guess you would have to, it's kind of like a custom medicine. This is not a bad idea, actually. When it comes to eating right and dieting right, exercise right, our bodies are different. Some people respond to things differently, and this is not a bad way of trying to address curing autoimmune disease, or basically putting it in remission. I don't know. I'm not going to say this one is better. I would say this one may be more specific, or I want to say person specific, because it looks like it's cell specific, whereas the other treatment is more generic, which, and maybe they could use, I don't know if that's a good idea. Use a combination of both. You got two different types of cells running around helping you recover from this disease. It may not, but again, medical treatment is different. This is not like fixing a car, or if you're an IT guy, right? All you gotta do is like basically delete and reinstall the config file or something. This is this is people's bodies. It's a bit more unpredictable at times. You don't know, but these treatments look promising. I want to take a look at one or two videos where one video looks at, the first video I want to look at, it talks about intermittent fasting and how that could help treat autoimmune disease. I don't know, but I mean, I just want to give it a look to see the logic behind it. I'm not a doctor or anything, but maybe it works for some people. I can see why it would work. I guess sometimes when things seem a bit too simple, but sometimes the answer is more simple than we make it. Sometimes we make it overly complicated.
Based on a recent report, there are more people developing autoimmune diseases than people getting cancer and heart attacks combined. It's a huge problem, with the solution giving you a lot of side effects, as in prednisone. So there really, at this moment, is not a good medical solution.
I did read that earlier. There is an increase in autoimmune diseases as compared to cancer, and it's really weird why that is. There's another video that mentions that. I will look into that. I will play that video where they say maybe there were a reduction in hookworms. They basically have a hookworm treatment in that video. We'll go over that later after this.
Fasting. Wow. There you have it. Surprise. Now, what I thought was kind of funny in some of the studies that I read, they mentioned that, wow, you get these great results when you're fasting, but then when you start eating, you lose some of these fasting benefits. But what if you just practiced routine, regular, intermittent fasting, okay? Well, that might work, because the benefits for your immune system actually can occur over a period of hours of fasting. I mean, you can get immune benefits from doing 18 hours of fasting. But what I would recommend, if I were you and I had an autoimmune disease, is I would recommend OMAD, one meal a day on a regular basis, okay? And have a huge meal. But that would give you 23 hours of fasting, which would be huge.
I do think that's a great idea for fasting. Intermittent fasting seems to work for a lot of things. In fasting in general, it does, I've read that several times, it does help improve your immune system and rejuvenate your immune system, as well as keep a healthy weight. But at the same time, there are people who, they might try, but there are people who get the shakes, they get weak, they get fatigued. So I don't know if it always works. And then at the same time, I think it does work, but you got to take into account people's age and their health. Like this does affect people differently. I I know an older gentleman. He said he'd been fasting a lot, and he said it kind of gave him some medical problems. So you want to know how your body reacts to certain things. Everybody's body reacts differently to things, and our makeups are all different. And I do think fasting is great in general, but I do think that it should be taken with anything, taken in moderation, based on your health, your age, and what your body can handle. If it's one meal a day, or maybe it's just breakfast and dinner, or a large meal every day, or 2 small meals a day. However it works for your body, I think that's how the approach should be made in regards to fasting. The next video I want to look at takes a look at hookworms. I know I'm not laughing. I should be laughing. I guess it's a nervous laugh. I don't know, but on the surface, I would be disturbed ingesting hookworms, but they present a great scientific reason for using hookworms to help with autoimmune disease. I get the logic behind it, and hey, not everything has to be taken with a pill, right? There are natural things out there that help us to heal from diseases that we either ignore, forgotten about, or haven't looked into.
If hookworms kill tens of thousands of people around the globe every year, why are some Kiwis knowingly infecting their bodies with them? It might sound literally hard to stomach, but there's growing evidence that they can be revolutionary healers in our gut. As Kiwi scientists explore the research, Matt Chisholm meets those who say the wee wrigglers have changed their lives, and he considers joining them.
I'm just giving myself a Nicotor americanus. It's a human hookworm.
How many in there?
6. I'll feel a little tiny tingle, and then they go into your bloodstream. Right, I'll just get you to take that on for me.
On it, just there.
Yep, that's good. And you cough them up, like a little... You don't even notice it. And then they go back down, you swallow them back down to your tummy, and that's where they live. And they breed there and have eggs.
Did you just say that the hookworms are having sex inside you?
Yeah, I did say that.
Do you think you're a weirdo?
Only in that respect, as other people might think so, but I'm not weird. I did a lot of reading around this, so I think the scientists are clear about it, that they do have good effects.
How big could this be?
Oh, enormous. One, they're cheap, they're reliable, they last many years. You can imagine one shot wonder for 5 years instead of pill popping.
There is an ick factor here, though, isn't there? They don't look good under the microscope, these little buggers.
Yeah. When you're healthy and you're feeling all good, but I tell you, if you've got some of these horrible diseases, you will do anything to change your life.
Yes, if you're really, if your disease is really bothering you, you can develop a bravery or a boldness to kind of go this direction. On the surface, it looks, like, okay, I thought these were supposed to be bad for you, but I guess I would look at it as the same as how some people use leeches for medical treatment. I forgot what it was. Was it for blood clots? There was something they used leeches for, and I think it was blood clots. I can't remember. But again, everything that may seem dangerous may not. There's a good